This is James. He's here at his doctor's office for a routine checkup. His health is fairly robust, and he's excited about getting to speak to his doctor to catch up and get genuine healthcare advice that he has gotten his entire life from his doctor and other physicians that he has sought any time he has needed help. James should feel this way. He lives in the United States, a country that has built a prosperous and ingenious healthcare system on the laurels, hard work, and ingenuity of the American people. But the problem is, the American government and lobbyists, a mere 500 politicians, a few lobbyists, and a handful of insurance executives want to determine how 300 million Americans get their health care. That's why today James doesn't really have his doctor's attention. He's buried in paperwork with an insurance company's leash around his neck pulling him in every direction. And not just James' doctors, but the nurses and the administrative staff is a bit concerned with everything else but James' health. The truth is, there's a brick wall between James and his doctors. Insurance regulations, government regulations, CPT, ICD, and HIPAA regulations, defensive practices that overtest. It's all too much for a doctor to practice what they spent their lives learning to do. If this is how our healthcare system works, what are we paying for? America has lost its magnificent vision of how healthcare should be. It's time to make healthcare in America great again. We need to empower our patients, get the government and insurance out of healthcare. Doctors should be the ones making medical decisions for their patients with no interference in between. The patient should be the one in charge of cost and the privacy of their medical needs. That's the power of the brilliance of the American people and the American dream. Together, we can live in a world full of health and prosperity.